Hi, everyone. I'm Dr. Krista Burris.
And I'm Dr. Michael Kim.
And we're here from Coachella Valley Direct Primary Care. And today is April 28th, 2021. And we're going to give you a quick update about the state of coronavirus here in the Coachella Valley.
Well, how are you doing today, Dr. Burris?
You know, I'm feeling pretty good. The weather is warming up, and honestly, there's been a lot of wind, and now it looks like it's kind of dying down. How about you?
Other than allergies, I think earlier this week they were acting up because of the wind and stuff. It's not been a horrible week, but it is windy. So
Very good.
Well, do you want to dive into the numbers?
Sure. The first slide we're going to look at today is today's daily report from Riverside County. And you'll see here some interesting things on here. One is that it only puts our new cases at 3. Probably what we're going to see is tomorrow we'll have new cases around 300. Because basically what that tells me is they didn't do any reporting of new cases today. And so they have been running in about the mid 100 range. So most likely we'll see sort of 2 days reported out tomorrow. Either that or they'll amend today's report and add the cases on today. But I don't think that's actually accurate. Good news, though, is our hospitalized numbers are continuing to fall, and we're down to 73 in the hospital and only 19 in the ICU in the whole county. This is really good news. So I am happy we're starting to see this continual fall. Also, not on this slide, but our rate this week for our cases per 100,000 was 3.9. Last week, it had gone up to 4.5, and I was a little concerned. So this is a nice turn in the right direction this week. I'm very happy to see that. As well as our positivity rate for the week was 2.1%. We actually are heading back towards the yellow tier now. In order to get to yellow tier, our case rate needs to be less than 2 per 100,000, and right now we're about 4. And our positivity rate needs to be less than 2, and we're very close to that one. So we'll see if we make it to that tier before they decide to do away with the tier system altogether. But we're kind of at the point where it doesn't matter that much. Let's go down to the bottom here. And what you'll see here is that positivity rate, stabilizing. I had been concerned because we had dipped as low as 1.9 that we were seeing this just constant trend upward. And now it looks like we're stable and even maybe going down a little bit more at the 2.1 level. So again, good news, heading in the right direction. It doesn't look like we're currently on the spike back up. And remembering that we opened up a bit about a month ago, so we should have seen a bump by now if we were going to see one from that week's opening. So there still are other factors going on that can raise our rates, but right now it looks like we're stable. Let us look at the next slide. This is our weekly report for the Coachella Valley area, which is called District 4. And what you'll see here is pretty stable from last week as far as our new weekly cases at about 126. Good news, no deaths this week in the valley. And if we go down, we'll see our hospitalization is sort of stable, again, slightly trending up over the week. If you look at those numbers in the ICU, we've gone from 2 to 6. It's not a tremendous number of people, but it's something that's still keeping our eye on. But if our transmission rates stay stable, we shouldn't see a drastic increase in our hospitalizations. Our positivity rate is right on track with the rest of the county at 2.1%. So now I'd like to take a look at something that came out this week from the CDC. And this was some new guidelines regarding what fully vaccinated people can do versus people who aren't fully vaccinated. And fully vaccinated means 2 weeks after that second dose, or 2 weeks after the first dose of a 1-dose vaccine, the J&J vaccine. So if you're 2 weeks out from your last dose, you are on the right side of this chart. If you're anybody else, even if you're only 1 week out from your second dose, you're still on the left. And what you'll see is that these new guidelines, even some of the people on the left side aren't wearing masks anymore. So those first 2 categories are outdoor activities only, where if you attended a small outdoor gathering with fully vaccinated family and friends, you don't have to wear a mask. But if there's a bunch of people there that aren't vaccinated, you do. So that's that third one down. If you haven't been fully vaccinated and there's other unvaccinated people around, you have to still wear your mask. But if you are one of those vaccinated people, you don't. So that's their official recommendation, which I feel is maybe one of the more confusing things they could have done. I mean, honestly, it's hard enough with all the drama around mask wearing and all the highly passionate people on both sides of the mask wearing divide. But here's this guidance that's like, people at the same event, some have to wear masks and some don't have to wear masks depending on whether or not they're vaccinated. So this guidance is based on some new data that came out that showed that fully vaccinated people are really less likely to spread the disease than we thought that they might be. So we're sort of seeing some loosening in these recommendations, but honestly, I myself feel that these guidelines are overly complicated. And so I feel for all of us trying to figure out what we're supposed to do and then translating that into real life, actually doing it with all the peer pressure one way or the other. It's very confusing. So then here, if you go lower, you'll see dining outdoors with friends for multiple households. If you're vaccinated, you don't even have to wear a mask. And the recommendation, if you're not vaccinated, is that you maybe consider not doing that and wear a mask if you do. And then a crowded outdoor event like a live performance or sports event, this is the level at which even vaccinated people need to put a mask back on outdoors. So if you're in a crowded venue, even something like a church event outdoors, even if you're vaccinated, the recommendation is to put a mask on. And I feel like, again, this might confuse people. Why is it not a problem if there's not a lot of people, but if there's a lot of people, suddenly you're at risk and you need to wear a mask? Can you explain this at all?
Well, I think part of the problem with this is that people are going to say, this is exactly like the speed limit, right? 55 and above, you're going to get a ticket. 55 and below, no ticket. They're going to say, hey, this has such generalizations. When you're in a crowded outdoor event, well, a crowded outdoor event for me could be 100, and for someone else, that's 5,000 people. So the problem becomes is they start taking the letter of the meaning and the literal interpretations without the guidelines really saying, okay, this is really what happens, right? It's a respiratory droplet that most people can spread. And this is what we're trying to cut the risk down on. So, before the transmissions was so high, no one could go outside. Now that we have vaccinated people, now the rates are lower, depending on where you are in your city, you need to make sure that, these events are okay. Outdoor events most likely are going to be okay. However, you need to know the more people you add, the more your risk goes up, and let people start understanding those kind of nuances rather than saying, this is okay, this is not okay, this is okay, this is not okay, because then people go, well, what about this? And it doesn't say, what about this? The exceptions aren't on here and it gets confusing.
Right. And I do like that they put it sort of not this is safe and this is not safe. What they're saying is this is safer, this is less safe. So knowing that there is nowhere on this list where there's not a person who could contract COVID and die. Even the fully vaccinated people on an outdoor walk with another fully vaccinated person does not have zero risk. And I think people can understand, the idea of, I'm going on a walk outside. I don't have zero risk of being hit by a meteor falling from outer space, but it's very low.
Right.
But I have a much higher risk if I'm walking through a field of flowers of being stung by a bee, right? So in a sense, if you're standing in a field of flowers, you might want to have more clothing on to protect yourselves from bee stings. So if you think about it that way of, I'm in a slightly higher risk environment, even though I've got this vaccine protection, I'm going to also wear a mask because my chance of coming across one of these more transmissible variants is higher that I could potentially catch and pass to someone else. So in a crowded environment, even outdoors, I'm going to wear a mask, even though I'm fully vaccinated, even though I understand that my risk is low, it's just a little higher than if there wasn't a crowd.
Well, and the point is not being that maybe this event is a safe event, but you take 1,000 of those, one of those events, two of those events aren't going to be, but we don't know which one is not going to be. So if we all can follow these rules, we'll catch the ones we know are going to spread it, and we can slow this disease down even further, or the virus down. If everyone says, oh, it won't happen to me and we're okay, it'll continue spreading at the level it is.
I think the other reason maybe the CDC put out these guidelines is try to encourage people to get vaccinated. If they see, oh, wow, like there's all these things that I can do once I'm vaccinated without a mask. Like, that'd be cool. And maybe that was part of their rationale. I don't know. Let's look at the next slide, which is our indoor activity slide.
Which is even less confusing, not.
Okay.
Sorry.
So basically what this shows is that if you're vaccinated, things indoors get much safer, but you need to still wear a mask. That's basically all this slide says. So if you're vaccinated, you can go indoors with much less risk. Just keep your mask on because the risk is a little higher than it is outdoors. Now, if you're not vaccinated, you basically have the same guidelines that you've always had, which there are certain indoor activities that are more risky than others. So things where you're not around a lot of people and maybe you're in a bigger room, or maybe there are a lot of people with you are already vaccinated. Those are all things that lower your risk. Things that increase it are doing an activity where you have to remove a mask, like eating, or something where you're breathing very hard, like singing or exercise, or where you're crowded together, like in a crowded indoor worship service or a movie or a concert, those types of things. If you have not been vaccinated, those still pose a fairly high risk to you. So my recommendation for people who are trying to get back to those activities is to go ahead and get yourself vaccinated as soon as possible, because then every single potential chain of transmission that's broken by being vaccinated makes all these activities safer for everyone.
Right. And you have to remember, those masks aren't there to protect you. They are really more to protect others, because you're not going to be spitting everywhere. You're not going to be spewing these droplets. So that's why on the left side, when you're vaccinated, people are like, well, I'm protected. Well, that's true, but you could still spread it, even though you're not going to be transmitting it as a high level and maybe even not enough to affect many people, but there's still going to be one person out there or several people out there that can. So the masks are there to prevent you from giving it to someone else, especially if you're unvaccinated. You have the potential still to give it to many people.
Right. So that's a really good point. even if you're vaccinated, you can still spread it and you may not have any symptoms. And that's why in those close quarters, it's still a protection for those around you to put that mask on. And what they didn't put in here is their guidelines on small gatherings indoors where everyone is vaccinated, even if they're from different households. Their guidelines are still that you do not have to wear a mask, or masks are not necessary if everyone in the group has been vaccinated, even if they're from different homes. So that's the one caveat that's not on this chart. But I believe those advisory statements still stand. So is that confusing enough?
Yeah. So I think the bottom line is, get your vaccine. If you have any questions, you can put them in the comment section. You can talk to your provider. You can talk to many of the public health departments, and we can answer questions, because I know there are legitimate questions. It's not just yes or no, you'll get it or you won't get it. So, but we do recommend everyone can get it so that we can get out of this pandemic. So please join us on our next show, which is Your Personal Health. And we thank you for joining us today for the COVID-19 update for Coachella Valley. And we'll see you guys next week.